Welcome to Pharmacology Mini number 5, where we're going to talk about medication safety. Medication errors are one of the biggest preventable errors in the hospital field and healthcare settings. Medical errors occur from inappropriate use of medication. So this could be the wrong dose, the wrong medication, the wrong patient, improper technique, improper monitoring of the patient, using expired medications, and not checking drug interactions. They can cause harm to the patient, or they may cause no harm. The harm can be very severe and result in death. As I mentioned, medication errors are a leading cause of preventable death in hospitalized patients. In order to prevent medication errors, there's a lot of safety mechanisms that are in place. First being med checks. Typically, we recommend at least 3 med checks. You should be checking all the medications, when pulling the medications, when preparing them, and then before administering. When you do your med checks, you're checking your med rights. So you're verifying that it's the right patient, right dose, right route, right indication, right time. And after giving the medication, you want to make sure that you've done the right documentation. Other ways that we can prevent errors is by safely checking compatibility, making sure that we have proper administration technique and that we're trained and prepared for whatever form of medication we're giving, that we've provided patients with the proper education. This is going to be especially important because sometimes patients will question their medications, and they question it because it's not the right medication, or maybe it's a different time than they typically take it. So that's a good way to check and verify our rights as well. We also want to check for any warnings. Some medications have black box warnings, which indicate when it may or may not be appropriate to give. We also want to check for any special disposal warnings. So for example, certain vitamins or chemotherapy may have to be disposed of, the packaging or the medication, in special containers. Lastly, you want to check your medications for any similar names or any abbreviations. In the nursing field, we have some accepted abbreviations and then abbreviations that should not be used. Make sure you know that for your healthcare facility. And as I mentioned, make sure that you're always checking that you have the right medication, because some medications do have similar sounding or spelled names, and you want to verify that you're providing the right medication and not getting confused with another. And that is a brief overview of medication errors and safety.